Hi, you're with Lucy for CVFM today. I have a special guest with me today. We've got Laura Walsh with me, who is in the public sector of South Tees and works within Borough Council. And we're going to talk today about cervical screenings, basically. It's Cervical Cancer Prevention Week this week. And Laura's going to be answering some of the most frequently asked questions about the cervical screening, when to get it, why do we get it. So welcome, Laura.
Thank you for having me.
No problem. Now, a recent study showed that only 12% of women even really know how HPV is involved with the screening. Do you think you could give us a bit of a background about HPV in general and why we do the screenings?
Yeah, so HPV is the virus that is the leading cause of cervical cancer. It's contracted through skin contact.
Yeah.
Most usually through sexual intercourse.
Right, okay.
And it's not just cervical cancer that it is a major contributor of. You've got things like your cancer of the vulva, and they are linked to women, but you do find that it is linked to men as well. So you've got your penile cancer that it is an increased risk factor for as well.
That's
so
really
very common.
Yeah.
Most of the time the virus is it's not harmful, right. But there is that increased risk of those cancers.
Great, thank you. That's really interesting to know because I've recently been for my own cervical screening as well, which you can hear me talk about on CVFM radio at 6 p.m, Women's Power Hour. But yeah, I recently went for mine just because I got the invitation really, but I didn't know really much that HPV was this virus that caused different types of cancer and that it's like,
out there.
Yeah, it's out there. Most people have it, but it's usually kind of harmless.
Very harmless.
And I didn't know that it linked to cancer specifically relating to men as well. So that's really good to know, like the background of where that comes from. We already kind of have some protection from HPV. I got my cervical cancer jab when I was in school.
That's right.
And I know that there is sort of vaccine services. Could you tell us a bit more about the vaccines and where people can get those?
Of course, yeah. So the HPV vaccine is offered to boys and girls in year 8, so age 12 to 13. And that is just a routine vaccination where the school nurses will go into the schools and get all of the children together and just vaccinate at the same time. Okay. Once that vaccination is done, it's done. Nothing more to think about. Very much like a lot of screening, it's a 5-minute job. And it's there to protect and there to prevent more than anything as well. Yeah,
that's great. What if, for example, someone missed their vaccination in school, or you're a woman who they weren't doing the vaccinations when you were at school? What could you do about that?
Yep, so if you are eligible for the vaccine, you can just contact your GP surgery and they'll sort that out for you. That's just not necessarily related to females. If you are a man under the age of 45 who has regular sex with other men, you are also eligible as well, and a lot of people don't know that. Right. If you're listening and that is something that you think you could be eligible for, just pop along to your local sexual health or HIV clinic, and they will look into that for you and help you get that sorted. Okay, yeah.
So contact your GP. They're happy to give any missed vaccines,
Absolutely.
even if your child missed it at school, but also sexual health clinics and HIV clinics for men, or if you regularly
definitely
men
the
having
option
sex
is
with
there.
men. Yeah, great. So we've talked a bit about the vaccine and how that's helping prevent the spread of HPV in general and help us get sort of inoculized to HPV in general and deal with that virus. If we go on to the screening in particular then, what's the process of that? So people will get invites and stuff. How often do we have to go? What's the sort of procedure, I guess?
Yep. So any woman, any person really with a cervix can get their cervical screening if you are aged between 25 and 64. That's just an open invitation. You'll get that by letter. Usually comes directly from your GP. And that invitation will come every 3 years.
Right.
There are some specifics to that. So if you go for a screening and you show cells, HPV cells, it won't be 3 years. That will come down to 1 year, and it will just be a routine screening check every year.
Yeah.
If at 2 years you still have some of those HPV cells within your cervix, you can then be invited to a hospital appointment, where you could be offered something called a colposcopy.
Okay.
And that is just a more detailed cervical smear under a microscope, and they'll just look in a little bit more detail what's going on with those cells, the blood vessels surrounding those cells, and then they'll take that from there for you. Other than that, it's just 3 years and you're done, really.
Yeah, great, thank you. I mean, my appointment recently, it took me, I think, 15 minutes total to get through my whole screening. So it's really sort of like 15 minutes versus missing something and possibly, risking your life, essentially.
Course. It's that message that we're trying to get out there, that 15 minutes could save your life. It's a lifesaver, or could save your mum's life, your sister's life.
Yeah.
It's a 5-minute appointment, the original appointment. The original appointment. So please go. Yeah.
So encourage your brothers, sisters, anyone with a cervix to
get out
please, respond to your invitation. Go get this done, and it could be the difference between spotting something early and it being treatable, or missing something.
Absolutely. The earlier it's caught, the better your outcomes, really. The reason that they reduce your screening down to every year is so that they can really focus on those HPV cells and really determine if there's any changes there. 9 times out of 10 there probably isn't, and 90% of screening tests come back and there's nothing. So while I'm giving this message that you could have to go every year, there's a 10% chance of that. 90% of them
absolutely
are
fine.
Absolutely fine.
See you in
You're
3
fit
years.
And healthy. See you in 3 years.
That's great. So we've sort of the vaccines there to protect us. We've talked a bit about why we do the screening, where you can get the screening, for example, so by invitation, etc. Would you mind telling us a little bit more about when you go for your screening, what happens in that appointment, just for anyone who might be nervous, maybe they haven't gone before and they don't know what to expect? Just
absolutely.
To normalise it, I guess, and just say,
and it should be normalised.
Yeah, we can talk about this, it's fine.
Yeah, it's a basic routine appointment that you can either go to your GP or your sexual health clinic for, and you go in, you will always be seen by a female nurse. Can't stress that enough, because that is a big deterrent, I think, for a lot of people.
So,
I don't want to go and see my doctor, he's a man. It won't be your doctor, it will be a female nurse that will see you. And the way I see it, Lucy, is it's 5 minutes out of my day where I can have a quick lie down and not have to think about anything.
I've never thought about it like that.
That's how I see it. It's have a little lie down. You'll be placed on a consultation bed. A speculum will be inserted.
Basically like a long duckbill.
It is, and all that does is that just opens up your cervix so that the nurse can have a good view of anything that she may see that's untoward at that point. A swab is inserted. They take a very quick swab of the cells around your cervix, and that's it, job done. The nurse isn't going to care if your legs aren't shaved, if you've got odd socks on.
I was literally going to say, so I had my own smear about 2-3 weeks ago. This was my second one in 2 years, because I had HPV cells last time. No abnormal cells though, so I was down to yearly. Last one completely clear, so back to 3 years for me, which is fantastic. But yeah, like you say about it just being a lie down, one thing that my doctor's surgery did that I just thought was genius, but so little, was when I laid down, they had a poster that was above my head of animated movie scenes, and you had to guess what movie the scene came from. And I just thought, you know what, that is so good. I took my boyfriend with me, so he was there, and the whole time the nurse's head was, down there. I was just looking at movie scenes and talking to my boyfriend about what movies we'd watched. The nurse was talking to me about what movie she'd just watched, even though she was sort of down there doing a thing. And I think, it's just normal, isn't it?
It's a very normal chat with a medical professional, and that's all it comes down to. You'll be offered a blanket, so you don't have to worry about your modesty. You know, should you choose to have one. As you've just said, you can take a chaperone with you.
Yes,
if you don't
another
feel
important
like you
thing.
Can go alone. I think that's really important to know, that you can have anyone in that room that you feel you need to have at that moment in time, just for support. And you're in and out before you know it.
Yeah,
you know.
Definitely. It was literally like 2 minutes of her down there. I didn't even really notice. I mean, she did tell me that mine bled a little, but that's just normal. Happens because they're collecting cells.
Yeah, that's normal.
Didn't really feel much. A bit of pressure maybe, but I mean, sometimes it can trigger sort of minor period cramps afterwards, but on the whole, really quick, pretty much painless. And in the face of saving lives, it's,
and certainly how I look at it when I go for mine, would I rather spend 5 minutes on that consultation bed, in that consultation room, having a quick swab, or potentially could I be spending time in hospital because it's 5 minutes out of my day that I chose not to take? And I think that's when you weigh it up. I think that's why it's so important.
And sort of the reason that we're even sort of like having this chat today, I suppose, is Cervical Cancer Prevention Week this week. So the message to get out there is really important. I just wondered locally if there was a difference, like how many women are going for these screenings, you know, does it change by region? What are we like in Borough?
So across England, you're looking at the average from the latest statistics is around 68% of uptake to cervical screening invites, which when you look at the population as a whole, that's a massive amount of people that aren't attending.
It's basically like a third of all women aren't going 100%. For their screenings. And
that's across England. If you were to ask me about Middlesbrough, that figure drops right down to 60%. So there's 40% of us out there that are either choosing not to go or don't know that they should be going, because let's face it, we all lead busy lives. Letters can be missed. Sometimes letters don't even get opened. But that is staggering to me, that something so simple. I mean, we all did COVID tests. They took 2 seconds.
Basically,
you know, I'm not saying it is the same, but it's very similar, that quick screening. And for 40% of people who are eligible to go, not to be going.
It's quite a...
It's something to think
about. It's a shocking statistic, I think, a little bit. Especially to know that sort of around Middlesbrough here, we are below the national average of people that are going for their screenings, etc. And you talked about us all taking sort of the lateral flow tests. I mean, I worked in the prison service at the time, so we were doing those every day as we went in. And I tell you now, I would rather have someone swab my cervix than have another one of those up my nose, because it was horrible.
And again, it's once every 3 years.
Exactly, it's not once every 3 years.
It's not a commitment when no one's asking you to make a big commitment for anything. A commitment for yourself, maybe, just for your own health. But, you know, we're not asking you to attend somewhere once a week, once a month. It's once every 3 years. And for 5 minutes, let's get that percentage up.
Exactly.
I think we can.
Yeah, definitely. Even just us talking about it, hopefully will encourage someone to see if they've had their letter, to check with their GP if they've missed one, or reach out to a sexual health clinic if you're a man having sex with other men, for example. And
even if you don't want to go to your own GP, if you think that, you know, there's a stigma around it being quite embarrassing, and that's fine. If you don't feel like you could go to your own GP because it is a bit too close for comfort for some things, you can go to your local sexual health clinic, and there is one right in the centre of Middlesbrough.
Yes, Brilliant.
So it's very, very central.
Yeah.
But there's lots of ways out there that you can get this done and you can get it organised.
Brilliant. And I know we've obviously highlighted a bit of a saddening statistic, I guess, for Middlesbrough, but 12,000 people with a cervix go for these screenings every single day, and the estimate is that it saves around 2,000 lives a year from catching something early that could have been something much more vicious.
Yeah.
So it does work. It's a brilliant thing that we have access to, that we're encouraged to do. And I just think, if you've had your invite, if you've missed it, if you can't remember the last time you had someone swabbing your cervix, please just
it's
reach
never
out
too
to your
late
GP.
to catch
Yeah.
up. There's no right or wrong with it. You might not have been for 5 years. That doesn't matter. It doesn't matter. Just please think about going at least. You know, talk to your friends about it. They'll have their own experiences that they can share with you. If that makes you feel a little bit better, you know.
Make it a girls' day. Get all your screenings booked.
Yeah.
Go for cocktails afterwards.
Yeah, screening and a coffee, you know, whatever works.
Yeah.
But certainly don't dismiss it, is what the message I would say.
Is there any sort of particular times when, for example, if you've just had a baby, or is there anything that sort of excludes you from?
Yeah, you're certainly not excluded if you've had a baby, and don't think that should be a reason not to go. 12 weeks postpartum.
12 weeks, great.
You can book that for us, and that's probably a perfect time to do it, because you're taking your child for their immunisations, you're protecting your child.
Yes.
Protect yourself at the same time.
Perfect, brilliant, love that.
If you've had a smear in the past, still go.
Yeah. Don't
just think, oh, I've already had one, so that doesn't matter.
Yeah.
Get yourself there as well.
And same-sex relationships, even.
Absolutely,
if still go get your smear. If you're past menopause, still you might still be getting your smear up to 64.
It can take you know, that screening needs to be there right up until the age of 64. Just go.
That's the message to leave you on then, is just go. Thank you so much for sharing your expertise with me today, Laura. It's been so wonderful to hear from you. You can check me out on CVFM at 6 p.m. on Friday evening with Women's Power Hour, where I will be talking to you about my cervix and my own screening. There will be an article on cvfm.co.uk if you would like to get a bit more information about HPV, the cervical screenings, what they do for people with cervixes all over, basically. Catch me on CVFM, and thank you so much, Laura, for joining me today.
Thank you.